Welcome back to Daybreak. Estimates suggest a significant portion of U.S. adults are not receiving their annual wellness exams. Only seeing a doctor when you're sick can often lead to several negative consequences, and here to help motivate you to seek preventative care is Dr. Beth Holcomb with Baptist Health Comprehensive Women's Clinic in North Little Rock. Good morning.
Good morning.
How are you doing?
I'm doing great.
This is such an important topic. We've been discussing it off camera. Let's go ahead and talk about the reasons why, the excuses you've heard that people are like, I don't need to go and do these wellness exams.
I've really heard all the excuses. There are many, and some of them are very valid, some of them not so much. Oftentimes, some people will just own up lack of motivation, or they'll say, I'm not sick, but the purpose of coming to see me is so I make your life easy, so when you are sick, you have ease of getting in. We can take care of you, and I know you and your health conditions, and hopefully prevent you from becoming ill in the first place.
Right. Well, let's talk about the importance of those wellness exams. Maybe also like the consequences of not getting them.
The biggest consequence of not getting the exams is delay in diagnosis, whether it be an acute condition, so you have a prolonged illness because of lack of access to health care, or a chronic condition that's been neglected, which can result in, increased risk for complications, increased cost for treatment, and just general suffering by our patients because they weren't taken care of.
And it's simple, right? Talk about what all goes into it, because you hear exam and you're like, oh my goodness, you think about needles and all the things, but it's pretty simple, right?
It's very simple. So the preventative visit type is my favorite visit. That's where I get to know people, I get to talk with folks, I get to know about their lives, I get to dive into their family histories and identify possible, hereditable cancer syndromes. We always get to get a general health panel. Usually, most insurances, 100% cover these types of exams. On the blood work, we do blood counts, and we look at liver and kidney function. We get to find problems before they're big problems, which is a really big deal, and it feels great, and it keeps people safe.
Yeah, so important. Thank you so much for joining us to talk about this topic today.
Absolutely.
And of course, if you want more information on Baptist Health, you can go to their website or give them a call. The information is right there on your screen.